So let's continue with anatomy MCQs on the hip region and the thigh. So remember, this is part 2 of this video series. We did question 1 to 10 in the previous video, which is part 1. So here we are going to start with question 11. So question 11 reads, the primary abductor of the hip joint is A. Abductor externus, B. Piriformis, C. Pectineus, D. Gluteus medius, E. Sartorius. So the primary abductor of the hip joint is the gluteus medius. So the correct answer here is D for question 11. So move on to question 12. The ligament of the hip resisting extension is the A. The transverse, B. Ligament of the head, C. Ischiofemoral, D. Pubofemoral, and E. Iliofemoral. Okay, so among these choices which have been given here, which one is the ligament which resists extension? So let's look at this diagram here. So we have two ligaments here. We have the iliofemoral ligament, okay, and then we also have the pubofemoral ligament. So among these ligaments, which one is responsible to resist the extension? Okay, so the one which is responsible for resisting is the iliofemoral ligament. This ligament here, which is in red, that ligament is responsible for resisting extension. This other ligament, which is pubofemoral ligament, is responsible for resisting abduction. So resisting, if you abduct the femur this side, then the one which is responsible for resisting that movement is the pubofemoral ligament, but for extension is the iliofemoral ligament. So the correct answer for question 12 is E. Iliofemoral femoral ligament is responsible for the resistance of extension. So we move on to question 13. The sciatic nerve lies between the greater trochanter of the femur and the ischial tuberosity of the pelvic bone after it emerges below which muscle? A. Gluteus medius, B. Obturator internus, C. Piriformis, D. Quadratus femoris, and E. Gemelli. So among these choices, after which muscle does the sciatic nerve emerge? Okay, it emerges below which muscle? So in this diagram, we could see this is the sciatic nerve after coming from its roots there from the lumbar and sacral plexus. It passes below the piriformis muscle. This is the piriformis muscle originating from the sacrum to insert on the greater trochanter. So underneath, it emerges below the piriformis muscle there. So this is the piriformis muscle. So the correct answer here is C. Emerges below the piriformis muscle. Question 13, the correct answer is C. Question 14. Regarding the posterior superior iliac spine, find the false statement. A. Marks the posterior end of the iliac crest. B. It's marked by a skin dimple. C. Lies at the lower level than the anterior superior iliac spine. D. A line drawn through the left and right posterior superior iliac spine lies opposite to S2 vertebrae. E. It's located about 5 centimeters lateral to the medial plane. So the first statement is E. It is located about 5 centimeters lateral to the medial plane. So this is very false. So it's very incorrect. Why? Because it is not located 5 centimeters from the medial plane. Okay, the posterior iliac spine, posterior superior iliac spine is very close to the medial plane. This 5 centimeters is too much. Okay, so that's why E is false. Question 15. In the gluteal region, find the false statement. A. Injections are given in the upper inner quadrant. B. The superior gluteal nerve supplies gluteal muscles and tensor fascia lata. C. When the sciatic nerve divides while in gluteal region, the tibial nerve pierces piriformis or leaves sciatic foramen above piriformis. D. Gluteal maximus muscle is separated from the greater trochanter by a buzzer. E. The gluteus maximum has a wide origin between the anterior and posterior gluteal lines. So in the gluteal region, find the false statement. So question 15, the correct answer is A. A. Injections are given in the upper inner quadrant. That is false. Why? Because if we look at the quadrants of the hip joint or hip region, it has lateral quadrant here. Let me just change the color. So it has the upper lateral quadrant, lower lateral quadrant, and we also have lower medial quadrant and upper medial quadrant. Okay, so these quadrants where injections are safely done is in the upper lateral quadrant. Okay, upper lateral quadrant, that's where self-injection site is, not in the upper inner quadrant. So A is a false statement. 15, the correct answer is A. Question 16. The iliac crest gives attachment to the iliac crest gives attachment to the A. iliacus, B. tensor fascia lata, C. gluteus minimus, D. gluteus medius, E, B, and C. So the iliac crest gives attachment to the tensor fascia lata. The tensor fascia lata. So this is the tensor fascia lata. It attaches. It inserts on this tract, which is the tibia tract, and then it originates from the iliac crest there. So the iliac crest gives attachment to the tensor fascia lata. The correct answer is B. Let's move on to question 17. Remember, don't forget to like, subscribe, and leave your comment concerning this video in the comment section below. Question 17 reads, the greater sciatic foramen is formed by the following except A. sacrum, B. greater sciatic notch, C. sacrospinous ligament, D. ischial spine, E. sacrotuberous ligament. The greater sciatic foramen is formed by the following except. Okay, so let's look at the greater sciatic foramen. So the greater sciatic foramen is that foramen which is there in blue. So it is formed by, so this is the same foramen here. It is formed by the sacrospinous ligament, which is that brown ligament there. Then we also have the sacrotuberous ligament, which is this ligament in that colored color. Then we also have the ischial spine, which is this spine which is here, and the greater sciatic notch. Okay, so the greater sciatic foramen is formed by the sacrospinatus ligament, the sacrotuberous ligament, and the ischial spine and the greater sciatic notch. Okay, so the correct answer here, which is not part of the boundaries of the greater sciatic foramen, is the is the sacrum. A is not part. So except A, which is the sacrum, the greater sciatic notch was there, sacrospinatus ligament is there, ischial spine is there, and sacrotuberous ligament is also part of the greater sciatic foramen, except the sacrum. Okay, so question 18. Which of the following statement is false about gluteus medius muscle? A, it is attached to the lateral side of the greater trochanter. B, it is innervated by the superior gluteal nerve. C, it is essential for normal walking on flat ground. D, it is an abductor of the thigh at the hip joint. E, part of it is inserted into the iliotibial tract. Okay, so which one of these is false about gluteus medius? E is false. Why? Because gluteus medius do not insert in the iliotibial tract. So in this diagram, we could see this part here is what we call the iliotibial tract. This is the iliotibial tract. So the iliotibial tract gives insertion to the gluteus maximus and tensor fasciae lata, which is that muscle on top there, not the media, the gluteus medius. Gluteus medius inserts on the greater trochanter. So that's why we are saying E is false. It is a false statement. Question 18, the correct answer is E. Question 19. Which of the following muscle lists take origin from the ischial-pubic ramus? Which of the following muscle lists take origin from the ischial-pubic ramus? A, semitendinous semimembranosus, and B, we have the sartorius, rectus, femoris, and obturator internus. C, glacialis, abductor brevis, and obturator externus. D, we have vestus lateralis, tensor fasciae lata, and vestus medialis. E, sartorius, biceps femoris, and abductor brevis. So the list of muscles which take origin from the ischial-pubic ramus is C, the glacialis, abductor brevis, and obturator externus. This is the list of the muscles which take origin from the ischial-pubic ramus. Question 20. So question 19, the correct answer is C. Question 20. The greater sciatic foramen transmits these structures except A, superior gluteal vessels, B, posterior cutaneous nerve of the thigh, C, piriformis muscle, D, obturator internus muscle, and E, inferior gluteal vessels. So which one among these is transmitted by... Okay, so which one is not transmitted by the gluteal sciatic foramen among all these? So the the greater sciatic foramen is that foramen there. So that foramen is going to transmit a lot of structures. So to remember them, you can just use this word, spin, pin. Okay, so spin, pin. So the S is for the superior the superior gluteal artery. The P is for the piriformis muscle. The I is for the inferior gluteal artery and nerve. And the N here is the nerve to obturator internus. We have the P here, which is for the pudendal nerve. Okay, the I is for the internal pudendal nerve. Those are the structures which are passing in the greater sciatic foramen. So except which one on this list, on this multiple choice here? So the one which is not there is the obturator internus muscle. The obturator internus muscle is going to be on the obturator membrane, not passing in the greater sciatic foramen. So except D. So question 20, the correct answer is D. All of these are going to pass in the greater sciatic foramen except the obturator internus muscle. Question 21. The most commonly recognized pelvic inlet in females is A. Arthropod, B. Platypoid, C. Gynecoid, D. Android, and E. None of the above. So we have these four types of pelvic inlet in females. We have the arthropod, platynoid, glycinoid, and android. So which one is the most common? Most common one is the gynecoid. It's the most common one in females. So the correct answer here is C. So these are the pelvic inlet. We have the gynecoid, it is round, and we also have the platypoid. This one is very shallow. Okay, so the one which is common is this one here. The android is cone shaped. As you can see, it is a cone like shaped or a wedge like shaped. Then this one is oval. Okay, so this may require a C-section, and this one there will be some difficulties in giving birth. Okay, and this one is mostly found in tall people, and birth may be possible but with some difficulties as well. Okay, once the baby has been delivered, then the arthropod. Okay, so this one is found in tall people. So the correct answer for question 20 is C. Let's move on to question 22. That was question 21. Question 22. All the following pass through the lesser sciatic foramen except A. Tendon of obturator internus, B. Internal pudendal artery, C. Pudendal nerve, D. Nerve to obturator internus, and E. All the above. Okay, so question 22. All of the following pass through the lesser sciatic foramen except what? Except E. So all of the above except all of these. So remember when we looked at the structures which pass through the greater sciatic foramen, we said the pudendal nerve passes there, the nerve to obturator internus also pass into through the greater sciatic foramen. The internal pudendal artery also pass there, even the tendon of the obturator internus. So all of these, they pass in the greater sciatic foramen. Okay, so except all of them. So the correct answer is E. Question 23. All the following muscles are supplied by the superior gluteal nerve except A. Gluteus medius, B. Gluteus minimus, C. Tensor fasciae lata, D. Gluteus maximus, and E. All of the above. So all of these are supplied by the superior gluteal nerve except the gluteus maximus. Gluteus maximus is supplied by the inferior gluteal nerve. Okay, so it is supplied by the inferior gluteal nerve, supplies the gluteus maximus, not the superior gluteal nerve. So question 23, the correct answer is D. Question 24, the root of the sciatic nerve are, the correct answer here is D. L4, L5, S1, S2, and S3 are the roots for the sciatic nerve. Okay, so it is L4, L5, S1, S2, and S3. The correct answer is D. So let's move on to question 25. The companion artery of the sciatic nerve is a branch of A. Superior gluteal artery, B. Inferior gluteal artery, C. Femoral artery, D. Obturator artery, and E. Abnormal obturator artery. So the companion artery of the sciatic nerve is, so in this diagram, this is the sciatic nerve there. So the accompanying artery is a branch of the inferior gluteal artery. So this is the inferior gluteal artery there. There is this branch here which is accompanying the sciatic nerve. So it is the branch of inferior gluteal artery. So the correct answer is inferior gluteal artery, which is B. So question 25, the answer is B. So thank you so much for watching this video. Don't forget to like, subscribe, and leave your comment concerning this video in the comment section below.